Hi everyone, my name is Alan. I'm a physiotherapist from Uganda, and in this video I want to talk about how you can do self-care for yourself or even a loved one in case you develop what is normally commonly known as Bell's palsy. Some call it facial palsy, but this is when someone gets paralysis of the muscles of the face, just one side of the face. Now, Bell's palsy comes from different sources. So it could be a viral infection, and it could also be what's commonly not diagnosed is psycho-emotional state of the individual. So talk about stress, trauma, anxiety, all that emotional baggage, even from the past, so can accumulate and someone gets this problem. So the nerve that is mainly affected is the facial nerve. The facial nerve has 5 branches. It comes from the brain, passes through the bones of the skull, and then the 5 branches distribute. The first branch goes just right around here to the front of the forehead. The second branch goes just around the eye. Another branch, the third, goes to the upper jaw. The fourth to the lower jaw. And then the fifth branch comes down to the neck. So someone gets paralyzed just that entire side, and the muscles of the face are affected, so which affects this person's facial expressions. So they can't close their eye, they can't form a frown, they can't smile, so the mouth droops towards the other side, and also the tongue can't move properly towards the affected side. Everything moves towards this side. So, and then in this video I'm showing you how you can do self-care, but this is just part of the treatment. You have to also understand that you have to treat where this is coming from. That's the root cause. So if it's a viral infection, then you get the treatment for that viral problem, and then for the psycho-emotional, you can talk to a therapist who knows how to work with emotional issues, and then they can help you work with this. So this will help so much in the process of recovery. I want to give credit to this work to a gentleman called Robert Rex and dermal neuromodulation, that's DNM. So all this is based on a DNM perspective. Thank you. Now, the only thing you're going to need to use is actually your fingers. Only your fingers. No need for oil or another massage or lubrication. You only need to use the magic of your fingers to work on yourself. So for the first branch, which comes to the front of your forehead, so place your fingers gently onto the skin of your forehead and get good contact with the skin. Now stretch the skin just like that, and stretch out, stretch in. So make sure the skin is moving because the nerves are just under the skin. Stretch just like that. Yes, so you can do that like 10 times, and then you're going to place your fingers like this and then stretch the skin just like that, up and down. So you want to get the skin moving, which will help those nerves. Just like this. Yes, so you can do about 10 times even for that one. Now for the branch which comes down to the eye, you're going to pinch the skin around the eye. So as you pinch it out like this, gently, and then back. Pinch, back, pinch here, back. Also for the upper eye, pinch the skin, back, pinch, back, pinch, back. You're going to play around the eye. You can do this. Stretch the skin around the eye. Stretch it gently. So we're also trying to improve proprioception to these areas, just like that. And then you can do up and down, so you can stretch. So you push down and push up, stretch that part, just like this. You can also do it for the lower eye, do gentle movements up and down, this, up and down. Also for the upper eye, you can do gentle movements up and down, up and down, up and down. Good. Now I'm going to work around this area because all these branches come from around here. Now place your fingers, one up, one just here, then stretch this area here, then push, stretch out, compress, stretch out, and compress. Then the branch which comes to the upper jaw here, so you can still do the same work of up and down, just around the jaw area, up and down. Just play around with the skin, up and down, around. You can also do side. So as you push, one hand pushes, one hand pulls. So you just play around with the skin around here. Yes. Now you're going to place your fingers just under these bones. If you touch this place, you can feel some bones here. So place your fingers under, then stretch upwards. From down here, stretch up. Can do a bit of that. Yes, now around the mouth, you're going to work the skin around the lips. You can place your fingers like this and stretch in opposite directions. Yes, and then you can stretch the mouth. You want to do this, then do it. Yeah, that feels so good. Now going to, so you can also pull the lips out and back. Yes. Now for the tongue, because normally the tongue can't move properly, so you're going to push the tongue back inside. So you take it out, then put your finger just in the middle of the tongue and push it back in. So you can use a glove for this, but since it's my own, I can use my own. Push back in. I bring it out. Oh. Yes, that's for the tongue. And when you come around here, the ear also needs to get some movement. So you're going to pull the ear in different directions. You can do up, down, this side and this side. Then find where the ear wants to go, like the direction of ease for the ear. So for mine, I feel mine wants to move up. So I can push it up and hold. I can push it up like this and hold. Same goes for the triggers of the ear. This. So put one hand behind the ear and also play with the trigger. See where it wants to go. Is it up, down, this or this side? So mine wants to go up also. So I can also take it up, just like that, and hold it. Now for the fifth branch, which comes down to the neck around here. So if you turn your head one side, you can see this muscle here, which really comes up, the SCM. So we can just come to the front of the SCM, just around here, and then play around with this, with the skin here. You can stretch the skin in different directions. See where the skin wants to go, and then so mine wants to go behind, so I can stretch the skin backwards behind here. Yeah, so try this on your own. You can do this as a do it yourself program. You can do it to a loved one. Thank you, and I hope this helps you.